Acceptance and commitment therapy is built on empirically based principles aimed to increase psychological flexibility using a mindfulness-based approach with behavior change strategies. We've said that several times in this training, and it bears repeating. Acceptance and commitment therapy is built on functional contextualism and relational frame theory and aims to increase psychological flexibility while using mindfulness interventions during empirically supported treatment plans. There are many different ways to discuss ACT, and one traditional introductory approach to the therapy is to use the ACT Hexagon Model. Steve Hayes and fellow behavioral scientists developed this 6-point approach to discuss the components that lead clients to greater psychological flexibility. The ACT community embraces the idea that acceptance and commitment therapy establishes greater psychological flexibility primarily through acceptance, defusion, establishment of a transcendent sense of self, otherwise known as the self as context, contact with the present moment, values, and building larger and larger patterns of committed action linked to those values. These 6 components form the ACT Hexagon Model, which is sometimes humorously referred to as the Hexaflex model, because it is the hexagon that leads to flexibility. Please take a look at this conventional ACT Hexagon model. And keep in mind that ACT comes from the foundation of behavior analysis and resides in the realm of cognitive behavioral therapy. Both behavior analysis and cognitive behavioral therapy are traditionally linear in their basic models. For instance, behavior analysis provided the historical context for ACT, and the typical behavior analyst takes a look at the study of behavior through an ABC model. Traditional behavior analysts talk about the antecedent, behavior, consequence, functions. A is followed by B, which is followed by C. Antecedents set the occasion for behavior to occur, and after the behavior, a consequence will make it more or less likely for that behavior to happen again. This is a linear process. And if you look at traditional CBT models, they are often linear models as well. For instance, Albert Ellis, one of the chief pioneers of CBT, the developer of rational emotive behavior therapy, forwarded an ABC model as well. REBT assumes that there are activating events that elicit beliefs that are followed by emotional consequences. If something happens in the environment that is aversive, it can be an activating event that leads to an irrational belief, which can lead to clinically relevant emotional consequences. In REBT treatment, this is to be followed by disputation in order to lead to effective emotion and action. So this is actually an ABCDE model. Again, very linear. And acceptance and commitment therapy comes from both traditional behavior analysis and is part of the CBT community. But look at the ACT model. It isn't a linear model. It is a circular model. Now you can joke around with me and say, it isn't a circular model, it's a hexagonal model, and I'd laugh and have to agree. But in philosophy, when we talk about circular models, we're highlighting that a method doesn't have a specific beginning point or ending point. And let's highlight that all the points on this model are equidistant from the center. So none of the components are more important than the other ones. The reason I'm highlighting this idea is not just to make an academic point about the history of ACT or to make a philosophical point about the model, but to emphasize 2 important application ideas. One is that as you start to do the therapy, you will not likely access treatment plans or develop treatment plans that say, in session 1, we'll talk about diffusion, and in session 2, we'll cover values, and in session 3, we'll talk about self as context, and so on. Could you imagine trying to help a client build psychological flexibility with such a rigid and inflexible treatment plan? In ACT, the therapist is going to model the model. In other words, you, as the clinician, will perform ACT more effectively if you observe your client's clinically relevant concerns as they show up in the therapy room and then flexibly move through the model to address whatever is showing up in the present moment. You flexibly model the model of flexibility. I mentioned that there are two important application ideas. The second idea is that being able to effectively model flexibility will require your own mindfulness skills. If you are going to effectively respond to your client, it will help a great deal if you work on contacting the present moment as regularly and fluidly as possible. You will once again be called on to model the model. Clients may regularly bring up new topics and issues that contribute to their own psychological inflexibility. It is incumbent on the therapist to be in the here and now, focused on the client's verbal behavior and overt behavior, and then address any clinical issues that come up with one of the points on the Hexagon model. You mindfully model the model of mindfulness. It will be helpful for the client to see your commitment to flexibility and mindfulness. Each one of these ACT components, acceptance, diffusion, self as context, contact with the present moment, values, and committed action, each one of them have their own way of being measured, and each of them have different interventions and skills building exercises. And this is a situation where the whole is greater than the sum of the parts. ACT utilizes these 6 components to blend together and increase psychological flexibility for the client. And if you recall from a previous video, the more psychologically flexible you are, the lower your scores are on measures of psychopathology and higher your scores are on quality of life inventories. We'll walk through each one of these 6 components in the next 2 modules. But before we do a deeper dive into the details of the ACT Hexagon model, it is important to highlight several ideas that have yet to be mentioned. First, the ACT Hexagon model is not the only way of talking about acceptance and commitment therapy. There are other approaches, such as the Mindful Action Plan, the Choice Point, the DNAV model, and the ACT Matrix, just to name a few. So as you continue to explore acceptance and commitment therapy, you will see it is a robust therapeutic endeavor with diverse ways of leading to psychological flexibility. Second, ACT embraces solid clinical skills in order to assist clients in developing psychological flexibility. We will not spend too much time on these concepts in this training, but understand that there is an assumption that clinicians will have empathy for their clients, teach concepts like self-compassion, and show unconditional positive regard with an equal, collaborative stance rather than an authoritative stance. The therapist will meet the client where they are at and not force the Hexagon exercises on the client in some kind of problematic manner. Self-disclosure might also be a part of the therapy if the clinician is ready for such a therapy move. We would want to demonstrate in session the oft-used phrase in the ACT community that we all swim in the same soup. Or, in other words, every person needs help dealing with the human condition, which leads to the third point. It will be very helpful if you, the consumer of this training, could start to embrace these concepts and apply them to your own issues. A psychologically flexible therapist is likely to be more effective, not just through modeling the approach, but in actually executing the applications with the client as well. In Module 2 and 3, we will introduce the 6 essential components from the ACT Hexagon and bring them all together to show how they facilitate each other in order to accelerate psychological flexibility. I thank you very much for completing Module 1 of Demystifying ACT. Before moving to Module 2, or prior to taking a break between trainings, I'm going to invite you to center yourself with a closing mindfulness exercise. take a nice, clean, full breath, and if it is safe to do so, during your next exhale, close your eyes. And for the next few moments, I'll ask you to stay committed to attending to your breath. Notice what it feels like to inhale and exhale. Notice the rise and fall of your chest, the coolness of the air as you inhale, and how it is warmer when you exhale. And if any thoughts come up that distract you from such a simple, present-focused commitment, I'll simply ask you to gently bring your attention back to the invitation, to attend to what you are doing in this present moment. Breathing. And I will invite you to take this same approach to any other behaviors you do after this training is over. Invite yourself to be fully in the present moment, committed to your important actions and simply aware of, but not distracted by, any thoughts or emotions you're experiencing. And now I will invite you to take another full, clean, deep breath. And when you exhale, open your eyes and prepare to be psychologically flexible as you go about to your day. There are 3 key points in this video. 1. There are many different ways to discuss acceptance and commitment therapy, but this training will focus on the traditional introductory approach using the ACT Hexagon Model. 2. Acceptance and commitment therapy's Hexagon Model is nonlinear, meaning that it is used flexibly depending upon what is showing up in the room with the client's clinically relevant concern, and such fluid usage will benefit from the clinician being more mindful of the present moment themselves. And 3, ACT is applied within the framework of good, solid therapeutic relationships, and therefore what you do as a therapist, as long as it is effective, is likely to blend very well with the acceptance and commitment therapy model.